My name is Rosemary Smith, and I'm going to be presenting on the antidepressant drug Remeron. So to give you a little history about this particular drug, Remeron was introduced back in the 1970s, 1980s, and was FDA approved back in June of 1996. This is a second generation of drugs, which basically means that there's a first generation of drugs out on the market. And the reason why second generations were created was to counteract some of the side effects that the first generation drugs have. The generic name for Remeron is mazaziapan, and the brand name is Remeron, Remeron Soft Tabs, or Remeron RD. So this drug is how this drug actually works, or the mechanics in regards to Remeron, is that this is an atypical antidepressant. So really it's not typical. And so it doesn't fit into other classes of antidepressants. It's quite unique, and this medication works in different ways from one another. Again, this is a second generational drug, and it's how this works or how it eases depression is by affecting the chemical messengers within the brain, which is basically the neurotransmitters that are used to communicate between the brain cells. So like most of the regular antidepressants, atypical antidepressants work by ultimately affecting change in the brain chemistry. And this by means affects the level of the neurotransmitters such as dopamine or serotonin. And what this drug usually treats, or the disorders that it treats, is schizophrenia, bipolar disorder, or major depressive disorders. So for today, this drug is going to be used for a client that is suffering from major depressive disorders. And in order for that client to be diagnosed with major depressive disorder, they have to meet 5 of the 9 criteria, or have 5 of the 9 symptoms that are out there. So the first symptom that I want to discuss a little bit about is basically depression itself. So if you have been diagnosed with major depressive disorder, you're going to obviously be depressed, and you're going to be depressed for more than a day. You're going to be depressed for a couple of weeks, and it's going to be every day, all day. And the symptoms of that is feeling sad, feeling empty, feeling hopeless, just an empty feeling. Another symptom of MDD is things that you used to enjoy every day, such as going for a walk, talking to friends or coworkers, or even watching TV or surfing the internet. Those things, those everyday things that you used to enjoy, you no longer find enjoyable. You find no meaning to any of those things anymore. Another indication that you may be suffering from MDD is weight loss. And I don't mean just a couple of pounds. I mean extreme weight loss without even trying to lose weight, without even dieting. Another symptom of depression is a change in sleep patterns, insomnia or hyperinsomnia, or just sleeping all day long, or not sleeping at all. And again, this could happen all day, every day, for at least 2 weeks. Another symptom that you may encounter is aggravation, or feeling fatigued, no energy, no motivation, and again, almost daily. You may feel worthless. You may have inappropriate guilt. And the last symptom that is very important to recognize is thoughts of death or suicidal ideation. So, with that being said, one has to wonder why have I been susceptible to MDD? What is it about me that has made me susceptible to this disorder? So there's a lot of factors. There's biological factors, psychological factors, environmental factors, chemical factors, inherited factors, even hormonal factors that can play a role in why one would develop major depressive disorders. So let's go over the first one, biological factors. So people with high genetic risk of depression are more likely to become depressed because of a traumatic or stressful event within their lives. So this actually will have an effect on the brain. It will change the physical qualities within the brain itself. Psychological factors, again, having a negative experience, having a traumatic event in your life or an stressful event in your life, and how you interpret that situation or that event. Did you internalize it? Was it a negative thing that brought on negative self-talk, negative thoughts? And as far as the environmental factors are concerned, this is probably within, it's not within your control. It includes outside forces, outside influences, such as your relationship with your co-workers, for example, or even your work environment. How do you handle stress in those situations? Another environmental factor could be your interpersonal or personal relationships. How do you deal with stress in your romantic relationship, in your family situation, with your children? Another one is loss of a family member or a divorce or separation. So how are you handling those things, those types of situations? And as far as brain chemistry, so that's a combination of genes and stress that can affect the brain chemistry and reduce our ability to maintain a stabilized mood. So another one, a more interesting one, is our hormonal factors. And if you as a young person knows that as a woman you go through different types of fluctuations within your hormones, especially as a young woman, every 28 days you're going to have some kind of high or even some kind of low because you're going through your menstrual cycle. So, during those times you may be extremely negative. You may have those hormones that are screaming out at you. And so that can create negative thoughts. That can create a lot of emotions during that time. And then there's other times when you are in your late 30s, early 40s, then your hormones become kind of muted. They're really going down, and that too affects your hormone levels. So can you imagine the responsibility that we as human beings have in regards to our hormones, and the responsibilities of those hormones to maintain our stability, our emotional stability, as well as our physical and mental stability. So that plays a key role in someone developing MDD. And finally, inherited traits. So this talks a little bit about how first generation relatives who have depression, this can affect an individual with a sibling who may have depression, or a mother or a grandmother or an aunt or a cousin. That the chances are, the vulnerabilities of having this increases from 2.5 to 3 times that of someone who doesn't have a first generation who's suffered from depression. So another question that a client may have in regards to taking the drug Remeron So if your doctor has prescribed Remeron, the patient really wants to know, or the client really wants to know, first of all, how is this drug going to affect me? How soon will I notice an improvement in my mood? And so as far as Remeron, you're going to notice an effect within the first 1 to 2 weeks of taking this drug. But those improvements will be basically in sleep. You'll have better sleep and a more solid appetite, and of course more energy. But as far as how long will it take for you to see a change in your mood and an overall well-being, that's going to take at least 6 to 8 weeks, because it takes time for this drug to get into your body and then to get into the brain and have that mood stabilizing effect. Some of the side effects that you may be interested in knowing, and the common side effects are, of course, going to be dry mouth, constipation, increased weight gain, increased triglycerides, increased cholesterol, and an increase in appetite, as well as issues with, again, constipation and confusion. Another thing that you might want to consider when taking Remeron is any side effects that you may need to discuss with your doctor, and those will include agitation, anxiety, even aggression is one. Any changes in your mood or behavior is another indication that you may want to consult with your prescribing physician, as well as panic attacks, hostility, aggravation, feelings of aggravation, as well as thoughts of self-harm or suicide. Another thing to consider when you are taking Remeron is what kind of other drugs may interact or have a negative effect or cause a bad reaction in regards to the mixing of the drugs. And I would caution anyone who is taking cold medicine or allergy medicine, any kind of sedatives, muscle relaxers, any kind of narcotics for pain, again, any kind of other mood antidepressant, mood stabilizers. And another interesting one is any acid reducers that you may be taking, especially Tagnet. That is one that you need to be cautious of taking while you're taking Remeron. Lithium is another one, and that is a mood drug, mood stabilizer that is prescribed, as well as narcotics for pain, which is Tramadol. You need to be cautious of if you're on HIV/AIDS medication, seizure medication, high blood pressure, or even diabetes medication. You need to be cautious of those. You need to consult with your physician before taking either one of those drugs. Another drug or another caution is the drug for blood thinners, which is warfarin. You need to be cautious of also taking that with Remeron. And another question that you as a client may have is, do I need to do blood test? How often do I need to do this test? So for Remeron in particular, you will be having to go in periodically, at least three times a year, to do a liver functioning test, because Remeron can affect your liver. And as far as any blood work that you may be required to do, your doctor will inform you as to when those will be needed. Other symptoms that you may want to be cautious of, if you decide that you are going to discontinue using Remeron, please be aware that there are side effects to discontinuing this drug without consulting your physician. And you risk having a setback, from the progress you have made if you discontinue this drug. Your symptoms and your depression can worsen also, and you need to be cautious of feelings of anxiety, worsening depression, flu-like symptoms, mania, your sleep pattern changing, your mood swings, as well as nausea, vomiting, nightmares, even fatigue, again, anxiety, nausea, abdominal cramping. So there's a merit of side effects that you will incur if you decide to discontinue this drug without following up and getting that done through your prescribing physician. So if there are any other questions or concerns, feel free to let me know and we can discuss those things also. Thank you very much.